Hey everyone, my name is Lauren Ray, and I'm a doctoral occupational therapy student at MUSC. I'm excited to share with you my capstone project and a little bit about sensory integration. My first objective is to learn more about trauma-informed care and medical complexities to get a more grasp of what these children at the foster care support clinic go through. I also wanted to address sensory needs that we established in my needs assessment prior to starting the experience in 2024. We did a needs assessment in 2022, which was about a year ago. I also want to provide resources to caregivers that they can use at home with their kids. I think this will be really helpful. The eight senses. I want to just briefly talk about this. We have five senses. There's an extra three that occupational therapists talk about a lot. That's vestibular, interoception, and proprioception. Something that I've seen in the clinic already is the environment versus the person. The environment we have at foster care support is two pods that are constantly moving, from one day to the next. It's hard to have space in this clinic as well. And other clinics obviously have a say in, what goes up on the walls, what goes on the ceilings. So something like this on the left, which would help with the bright lights. A lot of y'all kind of told me in the needs assessment that there's a ton of bright lights that the kids kind of get dysregulated by it. Obviously we need lights to work, but something that we could do for the environment is to cover them up with these cool like clouds, or they have different like patterns and things. Another thing that we could do is change the what's on the person. So we could put sunglasses on the child to help dim the surrounding light around them. Something that we see a lot with children that have autism is we'll see them wearing headphones that cancel the noise out. So a lot of background noise, too much noise can dysregulate some children. And we just want to be mindful of that. Deep pressure is one of the things that occupational therapy provides, and these weighted balls in the left will be provided to your clinic, and it will be in the sensory bin. Basically, what you can do with these, you can take the ball, you can put it on the wall, and you can kind of do arm movements with it, kind of straighten your arm and do the same thing. That's going to provide that deep pressure to the skin, joints, and muscles. The other items that will be in clinic are the weighted vests, the lap pads, and the vests. Those are similar to the ones on the right, except they are cloth. Ideally, we would want them to be wiped down, but that will be possibly in the future. We got free ones from Clap Your Hands, and these ones on the right are from Amazon and can be purchased there. The bean bags on the bottom, those can help a child with tapping, and you will get some sterile ones that came along with the Clap Your Hands items. If you kind of tap on your hand, up your arm, a lot of that can be considered rhythmic movement and can be regulating to children. So that's awesome. These are toys that will be helpful for infants. So on the right, we have chewable toys. Obviously in clinic, we may not want them to put things in their mouth for sanitation purposes, but a lot of infants are already putting it in their mouth, and some of them seek sensory input, like sensory oral input. And so by giving them this input, they may not grind their teeth as much. They may not bite other children. And the other ones are just like rattles and squeaky balls that have different textures on them. And this can just help either distract a child from getting a shot, or can help them and just learning the environment and that it's fun. We want kids to come to the doctor or nurse or whoever they're seeing, and we want them to build rapport. This is going to be for toddlers. We have these spinning spinners that can go on the wall. We also have light fixtures that can help with their visual system. On the right, you'll see that this toy, you're able to pull it apart, pull the strings through, and kind of pop the little things. These can be helpful for that tactile stimulation. The up top, those are tools that like vibrate. So anything that vibrates is kind of fun for a child because they can put it on their arm, they can feel it. We won't have those, but maybe soon in the future. School age children, these are kind of the toys I recommend, like the fidget tools, stress balls up top. Those will be in the clinic as long as the hourglasses, that you can kind of see the liquid moving back and forth. These are for adolescents. So obviously you wouldn't want to give a 2-year-old something that they can choke on. So just be mindful of the safety awareness of some toys. These are definitely for the older kids. So the snakes, the ball up top, and the hand one will be in clinic that you guys can use. The ball up top is pretty cool because it has a ball that you can follow the pathway through the ball, and it kind of keeps them focused and pretty distracted for the most part. So that'll be very helpful. These were items that we were going to organize with, but we decided to use a bin in one of the closets. It's going to be blue. And yeah, we're just really excited that you guys are able to use these materials in clinic. And if you have any other questions or concerns, please reach out to me. I will be in clinic this following couple weeks. Thank you.